Welcome everyone to the lecture on anatomy of the upper limbs. Here we will look an overview on the anatomy of the upper limbs, that how and what things and which type of information and knowledge we should have regarding the upper limbs. So, today we will delve into the fascinating world of the upper limbs anatomy and its significance in providing motion and functionality. So, understanding the intricacies of this vital part of the human body is crucial for medical professionals, physiotherapists, and anyone involved in healthcare. So, let's begin our journey into the bones, joints, muscles, nerves, and blood supply that make up the upper limbs and their practical applications in daily life and medical practice. An introduction. The upper limbs comprise the arms, forearms, wrists, and hands. This provide us with a wide range of motion and functionality. Look at this picture, you can see the whole anatomy of the upper limbs. And in this slide, we will talk about the bones of the forearms. The bones consists. Here we will look into the bones of the upper limbs. The upper limbs consists of three major bones: the humerus, that's the bone of the upper arm; the radius, and the ulna, that's the bones of forearm. The hand is made up of carpals, wrist bones, metacarpals are the palm bones, and phalanges are finger bones. In this slide you can see this picture about the bones or the osteology of the upper limbs. In this slide you will see that which type of joints we have in upper limbs. The shoulder joint has the glenohumeral joint that allows the arm to move in multiple directions and has a high range of motion. The elbow joint, formed by the humerus, radius, and ulna, that facilitate flexion and extension. The wrist joint, that's the radiocarpal joint, its distal joint, then the shoulder and elbow joints, and it permits various movements like flexion, extension, adduction, and abduction. So you see all these things in this picture. So you can see all these things in this picture, all the joints which are color different. And the fingers have hinge joints and ball and socket joints at the base. We continue looking into the muscles of the upper limbs. The upper limbs muscles can be classified as anterior and posterior compartments. The anterior compartment includes muscles which are responsible for flexion and adduction, such as the biceps, brachii, and pectoralis major muscles. Here you see that all the muscles in that picture. When we look into the posterior compartment, it comprises muscles responsible for extension and abduction, such as the triceps brachii and deltoid. We should know these compartments and it's all the muscles to know that there are different functions of each muscle, and each muscle is innervated by a specific nerve. In this slide we will look As an overview of nerves of the upper limbs, the brachial plexus that's shown here, it's a network of nerves originating from the cervical and thoracic spinal nerves. It provides motor and sensory innervation to the upper limbs, forming important nerves like the radial, median, and ulnar nerves. These nerves are originating from the brachial plexus that coming from the spinal cord from the cervical spinal nerves, also from the thoracic spinal nerves. So we reach to the blood supply. The upper limbs receive blood supply from various arteries, including the brachial, radial, and ulnar arteries. Venous drainage occurs through superficial and deep veins, which eventually drain into the axillary and subclavian veins. In this picture, you only see the arterial blood supply of the upper limbs that's important than the venous drainage. And now we should know the functional anatomy. As an overview, we should know that upper limbs are involved in numerous activities, including grasping, lifting, and fine motor skills. So, understanding the functional anatomy helps in diagnosing and treating upper limb injuries and disorders. For example, the dislocation of shoulder joint, like the humerus will be dislocated from the joint, and its dislocated shoulder. It occurs due to various mechanical factors. Conclusion is that we should have a comprehensive knowledge of the upper limbs anatomy because it's essential for medical students and healthcare practitioners. By revising these key points, you will be better prepared for your exams and equipped to understand and address upper limb related issues effectively. So, remember to practice with diagrams, models, and clinical cases to reinforce your understanding, and good luck with your exams. I will put some multiple choice questions in the description. Hope you will be able to solve these questions.